All right, so we're gonna work on subscap in this video. Subscap literally lies on the, if this is the scapula, if this is Kelsey's scapula and I'm bringing it to here, it is the anterior surface, basically almost the whole anterior surface of the scapula. And so we basically just want to figure out where the most restricted area is in that muscle belly and help facilitate getting that to let go. We can have an intention of perpendicular deformation into, or muscle play into the belly, or we can just work on tone if we wanted to. I am going to focus more on a directional restriction within subscap, which is more of a muscle play or perpendicular deformation technique. But just as an FYI, you can have an intention on trigger point, getting the muscle to relax. If it's super hypersensitive and tender, then maybe doing a trigger point technique would be best, and that's just sinking straight into the muscle belly to facilitate relaxation, okay? So in order to get on subscap, I just kind of make sure that their arm can be relaxed. If they're already tensing when I'm going to raise their arm up, the chances are subscap is going to be over contracted and their nervous system's not going to like it. So Kelsey's arm's nice and relaxed. I am sinking in to the front of her scapula. And then once I have the depth that I need to have to get on subscap, then I can kind of move around on the surface of the scapula. And right in this area is where I find a lot of restriction here, okay? So now I want to wind up which direction makes it feel most restricted, and actually if I'm scooping down and up towards her shoulder is where the biggest restriction is, but literally it could be in any direction on your clients. So again, get the depth, find the most restricted area, and then figure out which direction it's also most restricted, okay? So now I'm on the restriction, and so I could have her just breathe as a first option if it's super tender, okay? Or I could have her go into, if I want to lengthen, ooh, actually that's nice. If I just bring her arm into an adducted position, that gives me a harder infeel, okay? Which is relatively shortening that muscle. And then she could breathe there, and I actually kind of like that. If I want to go and lengthen that muscle from this position, I'll take her into external rotation, because subscap is an internal rotator, and then don't let me pull you out here, and then that kicks it right in. So I don't want her to do a whole lot there, because if she does, it's going to be super tender, and it'll kick me off. There we go. And again, hold. Good. And let it go. Okay. Fun fact is that, and you probably know this already, but it can be a little counterintuitive that to maximally lengthen subscap, you actually keep the elbow at the side and then rotate out, and that's the max length of subscap. So if you work on it all the way up here on that muscle belly, you're not necessarily getting lengthening of the muscle belly, but you could still find a harder infeel. So it's not that you don't want to work on it up in this range at all, but it's just having the knowledge to know, like, this is actually the max lengthening position of subscap. So that's working on subscap, soft tissue mobilization with a focus on either muscle play or muscle tone.